A team from Social Linkages for Youth Development and ChildLink is heading out on a community outreach. The organization works with young people and children dealing with substance abuse. And this community, back of Kawosh, a suburb of Lumley in the west end of Freetown, is home to a large number of them. Mustafa Keller, the head of this team, warns that they are about to enter an area that requires us to put away the camera or risk losing their target audience.
These are one of the hideout, the operational hideouts there.
Okay.
And I believe say as it stands now, this are the peak hour this, of the man so far.
Keller heads the needle and syringe exchange program of social linkages. His task is to ensure that young men who inject drugs are supplied clean needles and syringes so that they do not have to share the same needles and syringes, thereby exposing themselves to infectious diseases like HIV/AIDS. Drug users are one of four groups of people known as the key population most vulnerable to contracting HIV. The other groups are people engaging in same-sex relations, especially men who have sex with men, sex workers, and prisoners. Drug users are also in constant trouble with the law because of criminalization of drug use, which forces them to go underground and engage in unsafe practices like sharing of needles and syringes. Back at the office, Keller explains.
We are reaching out to this community with clean needles and syringe in order to discourage the reuse of syringes, because it's very difficult to get syringes as it stands, because syringes in our country are to be claimed or to be handled by prescription. So if it is not prescribed for you, you can't lay hands on it. So since that has discouraged, that has actually affected how to get the syringes. So we are now reaching out to them with clean needles and syringe, that will discourage the reuser, because this will actually prevent the spread of HIV among the communities. Because sharing one needle, imagine the first user of the needle might be, maybe the first user is reactive or positive with the virus. So having the second user, and of course, so just is going to transmit from one to the other. So we want to discourage that among them. That is why we are supplying them with clean needles and syringes, that is one for one. So at the end of the day, you can able to prevent yourself if at all you are dependable on the drug.
According to the 2019 Demographic Health Survey, the latest version of the report, the prevalence of HIV in Sierra Leone increased from 1.5% in 2013 to 1.7% in 2019. UNAIDS estimates show that the number of people living with the virus in the country now stands at 76,000 as of 2021. The recently published Sierra Leone Integrated Biobehavioral Survey and Population Estimates, conducted in just 6 of the 16 districts of the country, identified 7,615 drug users. Sierra Leone has made some gains in its HIV response, especially in areas like putting those who tested positive under treatment. But there is, however, very little optimism of the country meeting the 2030 UN Sustainable Development Goals target of ending transmission of the virus. Part of the reason for this is low testing. Only 51% of people living with HIV in the country know their status, according to government data. Campaigners and health authorities blame it all on stigma and discrimination.
For the key population, because of the barriers we have, the human rights violations, the challenges of stigma and discrimination that they face, so you realize that HIV prevalence among the key population group is disproportionately much higher than in the general population.
UNAIDS is the secretariat for the joint UN response to HIV/AIDS, and it is the lead advocate for the global response to the pandemic. It coordinates the efforts of 11 UN agencies to help countries reduce new infections and ensure that people who are infected get treated. Isaac Ahemesa is the UNAIDS country director for Sierra Leone and Liberia. He says the epidemic in Sierra Leone is feminized and concentrated in the key populations, which calls for a strategic approach focusing on the most at-risk groups.
It's mainly the issues about stigma, repressive laws. For the LGBTI population, we have the sodomy provisions in the constitution, in the penal code, that sentence people to more than 10 years for engaging in same-sex relationship. You have for the drug users, the country does not even discriminate. You have all kinds of drug use being criminalized across board, irrespective of the quantity that a police officer finds on a person. He will be charged and be prosecuted, just like if you have somebody who is trafficking drugs. So that is a major problem. We don't have harm reduction interventions for drug users in the country, and as a result of that, we've seen very high rates of overdose among that population. So even though we have opioid substitution therapy in the country, we are not being able to roll it out fully because of the legal barriers. These people are gone underground, and we cannot reach them with services to prevent them from getting overdose, to protect them from dying out of overdose, or even to give them needle and syringes so that they don't share needles and syringes that makes them vulnerable to HIV. So I strongly believe these are challenges that we have. And if you look at the UNA's global strategy, which talks about ending inequalities to end AIDS, what it simply means is that we need to ensure that these population groups have access to services, access to HIV prevention services, and access to treatment services to reduce infections among these key population groups. But when they are already infected, then we must provide them with treatment that will give them lifelong support and reduce the possibility of they transmitting the virus to other people.
The Needle and Syringe Exchange Program, one of such strategies, is part of the UN-supported harm reduction strategy, which emphasizes on the friendly engagement of drug users. It basically entails institutionalization of policies, programs, and practices that aim to minimize negative health, social, and legal impact associated with their lifestyle. Habib T. Kamara, Executive Director of Social Linkages, has been advocating for the review of Sierra Leone's drug law. He says every available data indicates that the hostile posture of the legislation hasn't only failed to reduce drug consumption, it also helps in fueling it. The demand for illegal drugs, he says, has become so high that it has spurred a local production line.
The situation of drugs use among youths in Sierra Leone is on an increase, and we have a lot of drugs in the street of Sierra Leone as we speak. But presently, the drugs that is in an increase is Kush. Kush is an indigo who hail from Pakistan and Afghanistan. But usually, since 2021, it started coming to this country, and this is really worrisome to us. And it has to be taken as a public health challenge and a public health approach to this nation, because it cuts across the two sexes, both the male and the female. And what is very worrisome is the reproductive health about these young people. The younger ones that are on these drugs, more especially the young girls, majority of them are in tertiary institutions. It cuts across those in schools and those out of schools. And these people are challenged in the sense, some of them that are on this substance never have what we call condom negotiations when it comes to sex. And early this year, the National HIV/AIDS said we have 76,000 people that are HIV positive in the country through a spectrum test. And we have 34,000 on treatment. The balanced are not on treatment. And this balance is in the youthful population, and more especially the key populations we are working with. And again, Kush is all over the country. And Sierra Leone lately, in the past 2 to 3 months, we have a lot of drug-related issues, either smuggling or in other ways.
The current explosion in drug use among youths in Sierra Leone started in 2019 with the importation of large quantities of the opioid pain medication, tramadol. They later moved to baby diapers when government restrictions led to increase in the cost of tramadol. The water-absorbing chemicals in the disposable nappies, the so-called diapers tea, attracted addicted drug users who couldn't afford tramadol. In the last 1 year, the drug of choice among most users has been Kush. The strain of cannabis was originally imported from Asia, mainly Afghanistan and Pakistan. But lately, some people identified a way of manufacturing something with similar effects locally. Former drug user Abdul Kagbo says there are many other kinds of drugs in the market, depending on what one can afford.
The main one like the tramadol, the kush, the jamba, the heroin, the gladi. Even some are presently where they use a vote stick for smell, for let it just hype.
Those are chemicals.
Just a chemical, just a hype. Open and so put in nose for just for like.
What thing they cause that now? Because of the no get
Drug
money for buy the
addicts.
other one?
Because some man don't get that kind of money to buy that drug. Because that drug there at times it can cost you 5,000. Not so everybody can get that 5,000 to go buy. You know, so you can prefer open out and call it sniff.
Abdul is a former client of social linkages. He recalls being an ardent drug user some years back when he encountered peer navigators in the same community where he lives, who introduced him to the needle and syringe program. He says with psychosocial counseling, he eventually decided to stop taking drug. Kagbo is presently in third year at the University of Sierra Leone, where he is pursuing a degree course. He is one of many social linkages workers, comprising 70% of its staff, who were once drug users. They are referred to as change agents because they now use their experience to help guide their former colleagues.
But we as a field change agents, we dey reach out to them, we talk to them, buddy. No means when they take drug, everybody from us saying that the drug user, they go change their life one kind way, pull them from the wrong way to the right way. And for the future, because the same advice me back listen, and I know always a message where I can always reach out to them. Send me back and the same one they meet me I get to way God makes it that I go thank you.
Social linkages operates in 4 districts: Bo, Bambali, Western Area Urban, and Western Area Rural. Last year, it reached 1,013 people. Some 883 of these were tested and 115 found to be HIV positive. Among these, 85 were put on treatment. As at the end of July, only 35 of them were still on treatment. The rest were lost to follow, meaning they could no longer be found. Some became defaulters. Defaulting from HIV treatment has detrimental consequences, including development of viral resistance, treatment failure, and increased risks of disease progression. Life-saving information like these are what peer navigators like Abdul provide their clients. One of these, John Dumbuya, an HIV-positive drug user, says his interaction with social linkages helped him make informed choice on how to maintain a healthy living, even though he chooses to continue injecting drugs.
Me, I need to exchange any syringe or any tooth person. I did do it on my own. For now, I feel for say as safe. I didn't the safe as.
But a lot more other drug users out there are missing out on these services and information. Social Linkage's harm reduction approach, supported by the Global Fund as part of its Breaking Down Barriers to Health Services program, is geared towards removing limitations imposed by society on these people, like the criminalization of drug use. Sierra Leone's current drug law was enacted in 2008. It was a hasty response to the infamous arrest of a plane loaded with cocaine that landed at the Freetown International Airport. The authorities were so determined to send a strong message to drug dealers that the drafters of the law overlooked human rights issues, which campaigners say today have a counterproductive effect. The country's poorly funded National Drug Law Enforcement Agency also sees the need for a review of the law. Habib says his organization in 2019 raised the alarm on the issue of baby diapers and no one listened. About a year later, he notes, It became a national concern, and it was late to act to prevent what became a disaster, claiming the lives of many youths due to overdose. Presently, a major concern for this organization is the local production of the illegal drugs, which Habib says makes it even more difficult to control. Those who make kush reportedly use dangerous chemicals, including formalin, an industrial disinfectant which is used as a preservative in funeral homes. They also use a nail polishing remover liquid. Consequently, stories of drug overdose, which lead to many deaths, among other consequences, abound in hideouts across Sierra Leone.
In this line, we are calling upon stakeholders, more especially the health personnel. Let us incorporate harm reductions into our health policy. And we are calling upon the government. Now that the NDLA, which is the National Drug Law Enforcement Agency, in their strategic plan and drug policy review is one of their targets. And the president in the second opening of parliament said that we should review the 2008 Drug Act, which came into being under certificate of emergency by the then government and the then parliament when the cocaine plane landed from Venezuela to Sierra Leone. We do not have any act or any policy to try those people. So the then parliament rushed to give us a certificate of emergency, to give us an act. After giving us that act, we see it as discriminatory to the users. Whenever there is arrest by security sector, the drug users are always arrested and incarcerated, leaving the supply route. If we want to, this is a simple economics. If we close the supply route, the demand should be reduced, as what was done for tramadol. Tramadol became increased in Sierra Leone, but what some of us as advocates, the pharmacy board and the police did, the price of tramadol went high. So the demands for tramadol became lower.
Campaigners specifically want to see the decriminalization of drug use and the incorporation of harm reduction into the new law. In the current law, the focus is on prosecuting and jailing of offenders, rather than rehabilitation and reintegration to society. For Habib, with the 2023 general elections around the corner, there can be no better time to review the law.
As emphasis was put on the Elections Act, I see the Drug Act more important again than the Elections Act, because if we cannot put emphasis on this act, we'll have a society which will be a failed society, we'll have a society that will be security threat, we'll have a society that will have an health challenge, and we'll have a society that will have a social problem.